What a lot of patients don't realize is that when they go and have procedures done other places or they have it done poorly, it really compromises our ability to fix it, meaning, adding bone, having to do more extensive procedures to get them back to a place where we can get them there.
It's always easier to do it right the first time.
Mm-hmm. I think that was a big thing for me with with having the opportunity to join this practice was in prosthodontics. It's pretty much what we do. We pick up the trash. It's a bulk of our practice is trying to fix things that were not done right, or we had a problem over here and then we just fixed this, and then we just fixed this, and over time you keep putting these patches on it, and patches do what they do. They end up ripping at the seams, and that's when they end up in our office.
And some patients will come in. We've all seen them. They come in with locator dentures, and they didn't know that they could have a screw-tane prosthesis that doesn't come in and out. And then they come to us because now they want us to fix it, and the implants are placed at the wrong spot. And now we got to take good implants out and then graft or place new implants when this all could have been avoided if it was treatment planned, if it was talked about, done right the first time.
There's a gentleman that I had the ability to take care of and help out in an exact situation. And so he shows up into my office very disgruntled, obviously, and it was a shame. And it was a hard conversation at first to let him know that everything was failing. And it makes you feel bad, but I will tell you, the outcome 1 year later was that he was so happy, and that's what we're here to do. Why not start with the guys here at Fusion Implant Center that actually do it right the first time and know how to handle complications if they are to arise. And that's a big part of what we do with our level of training.
Anybody can put an implant in, but it's managing the complications when they happen. With these cases that I think having a surgeon or a team of surgeons I have a whole lot more comfort in treating these patients.
And there's a lot of people who do implants, and they're not specialists. Obviously, the specialists do it, but we do this all day, every day. So we've seen the good, we've seen the bad. We actually can predict the good and bad before it even happens. And honestly, I think that's the biggest advantage for us is we can see it before it happens.
Like we talk about all the time, anybody can place an implant, but it all goes back to diagnosis and treatment planning. What does this patient need? Not, I'm going to, put 6 implants here. Diagnosis and treatment planning for everything we do is just so key.